There are a number of resources that can make up the prevention landscape in your community, including your county drug and alcohol office and prevention-focused coalitions. In this video, we'll discuss the important roles these prevention partners play in helping prevent youth substance use. Prevention science tells us that we need data on the root causes of youth problem behaviors in order to determine the best solutions, which is why it is important that you develop strategic partnerships that focus on addressing why the problems are occurring. The Pennsylvania Youth Survey, or PAYS, is the basis of the most effective primary prevention work in Pennsylvania. It allows users to identify the risk and protective factors underlying many problem behaviors prevalent in a community, such as alcohol, tobacco, and other drug use and access, antisocial behaviors such as violence and interaction between peers, community and school climate and safety, and social and emotional health. We strongly urge all school districts to participate in the PAYS, and in 2017 we had 387 of the 500 school districts participate. The survey takes less than an hour to complete and is free thanks to the Pennsylvania Commission on Crime and Delinquency, the Department of Education, and the Department of Drug and Alcohol Programs. To see if your school district participated in PAYS and to learn more about it, you can visit the PAYS website shown here. Let's begin our prevention landscape discussion by learning more about how one of your key prevention partners, your county drug and alcohol office, can assist your school with its prevention efforts. Your local drug and alcohol office receives state and federal dollars through contracts with the Department of the Drug and Alcohol Programs, or DDAP, to plan, coordinate, and provide local drug and alcohol prevention, intervention, treatment, and recovery support services. These services may be provided directly by the local drug and alcohol staff, or they may contract with other agencies or organizations to provide the services. Your local drug and alcohol office can provide a variety of prevention-related services such as assistance with planning, prevention programming, and funding for prevention activities your school can implement, including purchasing materials and curriculum, student assistance program liaison services, and training and presentations. Your county drug and alcohol office is also a great point of contact when looking for information and support for assessment and treatment services for those who may have a substance use disorder. To locate your county drug and alcohol office, please visit the DDAP website shown here. Pennsylvania has a strong network of prevention partnerships that is evident in the many coalitions operating throughout the state. The next part of this video will explore some of the coalition models that rely on PAYS and other data to employ risk-focused prevention planning. Communities That Care, or CTC, is the most highly researched model and is the basis of many coalitions found throughout Pennsylvania. It is grounded in a 5-step process. Number 1, mobilize to build capacity to address issues. Number 2, analyze data to determine issues and their causes and to set priorities and goals. Number 3, develop an action plan to address these priorities and goals. Number 4, implement this action plan. And number 5, to measure progress. CTC is instrumental in raising awareness of community issues, mobilizing the community to act, and to measure impact of the implementation of proven effective programs, policies, and practices. CTC works, and one large study found that CTC communities saw lower rates of delinquency, greater resistance to negative peer influence, stronger school engagement, and better academic achievement. Now, what school or community wouldn't like to see those types of results? To learn more about CTC coalitions in your area, visit the Epicenter website. Another widely utilized model is drug-free communities, or DFC. It takes an environmental approach to reducing the early use of alcohol, tobacco, marijuana, and prescription drugs by focusing on improving environmental causes of youth substance use, such as product placement and pricing, and community norms around alcohol and drug use. A DFC coalition utilizes the Strategic Prevention Framework, or SPIF, to guide strategic planning efforts. Your local SCA office also utilizes this model in its county-level planning. The reason for this is both are supported through the Substance Abuse and Mental Health Administration at the federal level. As you can see, this framework has many similar components to the CTC approach, including its strategic planning focus and the use of data to make decisions and show impact. From 2002 to 2016, DFC communities nationwide have seen reductions in the use of all of the targeted drugs, including significant reductions in the use of tobacco and alcohol by high school students. While both models focus on skill building and education, the biggest difference between the two is that CTC coalitions are focused on strategic planning for the selection and implementation of evidence-based programs such as life skills and strengthening families, and DFC's coalitions strategic planning efforts are focused on environmental strategies related to broader physical, social, and institutional changes such as policy change and reducing barriers to service. To see if there's a DFC coalition in your area, please visit the Office of National Drug Control Policy's website. Another coalition model utilized in Pennsylvania is the county-level opioid task force model. These coalitions are focused on decreasing opioid-related deaths through mobilization of key county agencies and focus on multiple strategies with a wide breadth, such as increasing availability of naloxone and treatment options. To learn more about the opioid task force in your county, please visit the Overdose Free PA website. There are several models that focus more directly on schools. Promoting school community university partnerships to enhance resilience, or PROSPER, is a program delivery system with a community team component that is grounded in the same risk and protection model as CTC, but operates directly with school districts to implement programs such as strengthening families and life skills training. PROSPER has strong evidence of success. Research has shown that students from schools that implemented both of these programs and followed the PROSPER model with fidelity had much lower rates of heroin use into their 20s. To learn more about PROSPER, please visit the PROSPER Partnerships website. Community schools is a model where educators, parents, community partners, and others create a shared vision. This model includes tools such as engaging and expanding instructional opportunities, health and social support, and community engagement. To learn more about community schools, visit the Coalition for Community Schools website. To recap, you have many supports in your prevention landscape, including your local drug and alcohol office, and many types of coalitions that may differ in scope and format, but that all find strength in a data-driven, risk-focused approach to prevention. We encourage you to reach out to these strategic prevention partners in your area.